Welcome to the Bryan Health Virtual Career Fair. I'm Dr. Lisa Vail, Vice President of Patient Care Services and Chief Nursing Officer. I've been with Bryan a little over 8 years, and I'll celebrate my 40th year as an RN later this year. It's an honor to welcome each of you to our recruitment event this morning. During this morning's event, you're going to have the opportunity to meet some of the dedicated nursing leaders and human resource partners that call Bryan their work family. We will share with you a little bit about our organization, as well as some very rewarding nursing opportunities that we have for you, experienced nurses, as well as new grads. I'd like to begin by sharing with you a bit about Bryan Health. We've got a map here for you to see what the footprint of Bryan Health looks like. There we go. Bryan Health is comprised of 3 hospitals, Bryan Medical Center in Lincoln, Crete Area Medical Center in Crete, and Merrick Medical Center in Central City. We also have relationships with the Grand Island Regional Medical Center and a management agreement with the hospital in Wahoo. We also have many different areas where Bryan has a presence across the state of Nebraska and other parts of northern Kansas and western Iowa. And those are part of our Bryan Health Clinic sites or our relationships with the Heartland Health Alliance, an organization of over 50 critical access hospitals across the region that Bryan has a very strong supportive relationship with. So you can just see who Bryan is and where we spend our time and our efforts supporting healthcare in the state of Nebraska. This past year, we launched a new vision statement that guides all of our Bryan Health efforts. Our new vision statement is elevate quality of life through better health. It's simple and it's easy to understand. We're here to improve lives through better health. Our mission statement you can see on the slide here is to advance the health of individuals in our region through collaboration with physicians and communities. This speaks to our relationship-based and patient-centric care approach. We realize that patients are key members of the healthcare team, and they are included in our interprofessional collaboration to improve their health. The Bryan mission statement then leads us into our model for personalized care. As you can see, it is patient-centric, and it is built upon a foundation of healthy relationships and transparent communication, supported by science and technology, driving the use of evidence-based practice while honoring the unique individual and personal story for every person. Brooke, could I see the next slide, please? There we go. That's our personalized model of care. And you can see the foundation there, and that my life, my story, my health, and all of those unique needs of our patients surround each and every one, and you can see what they are supported by. As we accomplish our mission by providing exceptional clinical care from a comprehensive team of the most skilled, dedicated, and compassionate individuals, clinical and non-clinical, that I've ever had the honor to work with during my career. Every member of the Bryan team takes pride in their work by living out our core values every day. And you can see those core values on the slide. There's one team, one purpose. Go the extra mile, or excuse me, spread a smile, go the extra mile. Live it and own it. Care like crazy, motivate, appreciate, know the way, show the way, and last but not least, enjoy the journey. You would see our employees, our members of the Bryan Health Organization living these core values each and every day as you walk the halls of our organizations. So who makes up Bryan? We are a 640-bed tertiary care, not-for-profit, locally owned and governed organization serving patients from across Nebraska, as well as Kansas, Iowa, South Dakota, and other states in the region. Some of our premier services include cardiology, neuroscience, orthopedics, vascular, a level 2 trauma center, emergency departments, critical care, women's and children's health, a level 3 NICU, imaging, and an extremely strong mental health services. We also offer inpatient rehabilitation, all general medicine, robotic assisted surgeries, and a comprehensive bariatrics program, just to name a few. We take pride in the culture we have created here at Bryan, and I'd like to just share with you a few metrics that demonstrate the strength of our organization. Last year, we had 88% participation in our employee engagement survey, scoring at the 94th percentile within the Press-Ganey healthcare data benchmark. That benchmark is comprised of 1.7 million participants and 450 healthcare systems. We are really, really proud of our employee engagement results. We also had great results last year from our providers, our key partners in providing healthcare, and our providers scored at the 93rd percentile within the Press-Ganey healthcare data benchmark. Bryan Medical Center holds over 72% of the market share for acute care in our primary service area, which includes a 7-county area surrounding Lincoln. We have received many clinical awards and recognition. One of the most recent ones that makes me very proud is the Nebraska Hospital Association Quest for Quality Award that we were awarded this past fall for standing up the state's very first COVID drive-through testing clinic last March 24th. We also maintain many accredited clinical programs, including cancer, bariatrics, multiple cardiac programs, stroke, ventricular assist device, substance use treatment and recovery, baby-friendly, rehabilitation, vascular imaging, and many more. Being able to earn these types of recognition comes from having an exemplary staff that works well together on important quality initiatives. A strong and healthy work environment provides multiple opportunities for professional growth. Additionally, we know that it is important to have an environment where nurses feel supported, recognized, appreciated, and that their voices are heard. At Bryan, we have a positive and supportive work environment for the professional RN, and this is measured in part by our strong employee engagement scores. Let me just share a few examples with you of some of the things that are available for our professional nursing support. We have a shared governance model. You're going to hear more about our Great Nurse Residency program later this morning. We train preceptors to provide an exceptional onboarding experience for our new employees. We have very strong interprofessional relationships with providers and other clinicians at the bedside. We've got visible leadership, the frontline managers, the directors, the senior leaders do rounding on a regular basis, and we believe that's very, very important. We create a safe working environment for you through a lot of different things, whether it's security, appropriate PPE, or all of the things that make an organization safe to work in. We also have a professional development program that you may consider. We have competitive salaries and benefits and many, many free CEUs. Some of the other things that we've done this past year related to COVID and our preparation for COVID created a great deal of support for our staff. And these are all staff from across the organization. And I'm very, very proud in our organization being able to provide these things for our employees. We kept pay whole for staff when closing outpatient areas early in the pandemic. We contracted with Sylvan Learning Center for homework support for kids who were now learning remote because schools had closed. We eliminated the short-term disability waiting period for staff who tested positive for COVID. We provided free meals to our staff on the COVID units so that they didn't have to leave the work environment because they were already wearing a lot of PPE, and it created workflow challenges that they didn't get in long enough time for their meal breaks. So we brought the food to them. We had pandemic pay for staff, and we still are utilizing pandemic pay as appropriate throughout the organization, and a great focus on the provision of PPE and safety. We implemented, and I believe we were the first to implement in our region, trained observer role back in April of 2020 to help our staff work in and out of the PAPRs and to keep them safe and free from self-exposure of anything related to the COVID virus. So really proud of our COVID response. And this is just a small sampling of the things that our organization did. Being part of an organization that has a caring and compassionate staff, excellent clinical outcomes, and a deep commitment to the community it serves is why my professional journey brought me to Bryan. I've been a nurse for a long time. As I said, it'll be 40 years later this year. I started as a nurse's aide in a long-term care facility like many nurses did back in college for the summers. I graduated with a Bachelor of Arts with a major in nursing in 1981, long time ago. And I started as a med-surg nurse on a general medical unit, working the 3 to 11 shift back when we were still doing 8-hour shifts. I then transitioned into the critical care arena from a clinician standpoint and joined a float pool, getting experience in cardiac, surgical, emergency department, and a pulmonary unit. And while I was a staff nurse on that unit, I earned my CCRN. I think if I remember correctly, that was 1984. And I've maintained a specialty nursing certification of one type or another since 1984 throughout my career. I then transferred to another organization in Topeka, Kansas, and became a staff nurse in a coronary intensive care unit. And while I was employed at that organization, a leadership opportunity presented itself, and I applied and was selected as the nurse manager for a 48-bed telemetry unit. While I was there in that role, I decided I needed some new tools in my toolbox as I was moving into leadership, and I started working on my master's degree. And I graduated from the University of Kansas in the late 80s with my master's degree. Then a short trip to Albuquerque, New Mexico took me to a coronary intensive care unit and a telemetry unit in that city at Presbyterian Healthcare. And from there, I moved back to the Kansas City area and spent 18 years at an organization in Liberty, Missouri, 14 years as the manager of the surgical oncology unit, and the last 4 years at that organization as the chief nursing officer. Again, I decided as I went to a higher level of leadership responsibility, I needed some additional new tools in my toolbox. So I went back to school again and graduated with my doctorate in organizational leadership in 2010. So it's been a great journey, one of lifelong learning, and I believe that there are limitless opportunities when we invest in ourselves and continue to be lifelong learners. At Bryan, as you invest in your professional growth, you will have multiple opportunities to engage in the nursing profession and make a difference in the lives of patients and colleagues alike. Through my career, my professional philosophy of nursing has evolved and matured, just as I have grown and changed with education and experience. I am passionate about nursing, and I thought it might be helpful for you to know how I feel about being a professional nurse. So I'd like to share with you my personal philosophy of nursing statement. Not sure if any of you have one of these, but I think it's a really good exercise to think about who we are and why we are a nurse. And this is what I believe. Nurses are innovative, intelligent, and skilled. But many of the characteristics of the exceptional nurse do not come from a textbook or a learning lab. They come from the heart and the soul. Nurses are first and foremost caregivers. This requires a deep concern for the well-being of others, respect for the individual, compassion for the broken, grace for the human experience, and humility for our personal call to service. Many other members of our nursing team share this same passion and these beliefs and are exemplary nurses. I know this because of the care and compassion they provide for their patients every day. These next few slides are going to just show you some pictures of the amazing nurses at Bryan. These are some of our recent Daisy Award winners and both the team awards and some individual awards. We give out and honor a Daisy Award winner every month. Here are some of our Beyond Expectations Award winners. This is a award that we encourage our patients to nominate individuals or teams for going above and beyond in the care of their loved ones or themselves. And they write letters and make a donation on behalf of these individuals to our foundation. And so we love to acknowledge and recognize our teams in their Beyond Expectation Awards. And I think there's one more slide with some great pictures. Here we are. Here are a couple of pictures of some of the stuff we've been doing the past year related to COVID, whether it's our drive-through testing site, our vaccination clinics, the hard work that happens at the bedside, and the success stories of seeing our patients get better and be dismissed. It's been a really interesting journey for us all this last year. In closing, this past week, I became aware that the American Nurses Association and the World Health Organization have officially extended the Year of the Nurse 2020 to 2021. And that's all because of the impact of the pandemic. And there really is no better time than now to acknowledge the sacrifices and contributions that nurses across the globe have experienced this past year. What an amazing time to be a nurse, and especially one at Bryan. Are you ready to take that challenge and make 2021 the best year of your professional career by joining our Bryan team? I hope you are, and I look forward to seeing you soon, and hopefully without a mask.